Well, I'm Dr. Spicher. I'm the absent medical director here at St. Anne's. It's been about 4 or 5 weeks since I saw you all, and my, how things have changed. So they asked me to come back and do this talk again with a little bit of an update about what we've learned, what questions still are out there, and how we're doing. So, what I'd like to accomplish today is just updating sort of what we've learned since we were last together. I'd like to talk a little bit about what our local situation is with the coronavirus in Lancaster County, and talk some more about how we can continue keeping safe. As you remember, this is all caused by a particular coronavirus. Coronaviruses have been around a long time. We've probably all had them. Many colds are caused by particular coronaviruses. The thing that is different is that now we have a new coronavirus that we haven't experienced before, and that's what's causing all the problem. That's the SARS-CoV-2 is the official name of this coronavirus. So we still don't know for sure, but there's a lot of evidence that probably this is a virus that has been living in bats for probably millions of years, and as long as it stayed in the bat was not a problem. It became a problem when it somehow found its way from the bat, probably to another animal, and then to a human, probably in China. And from there, you know the rest of the story. And because this is a new virus that people have never experienced before, our immune systems don't have any defense against it. We haven't seen it before, so it's very contagious. And this is something that is true of coronaviruses in general. It's not just this one. There's actually a lot of coronaviruses, and a lot of them started out in bats, and at different points in time they've gone through other animals and then into people. So if you remember a few years back hearing about the SARS outbreak, that was a coronavirus that happened to go from a bat to a camel to a person. So there have been a number of them over the years, and this is just the latest. So the disease we call COVID-19, that's the name of the disease caused by this coronavirus, and in general it is transferred from person to person through droplets. These are little tiny balls of mucus or water that come out of our noses and mouths and float around and then get breathed in by another person, or land on a surface and gets touched by another person. So in general, that's where the guidelines about social distancing come from. These droplets don't generally float around in the air, they fall to the ground and usually do so within 6 feet. So that's where that distance comes from. There's still a lot that we don't fully understand about surfaces, although it's generally thought that most hard surfaces, like plastic or metal, can tend to keep these viruses around longer, maybe even up to a couple of days. Other surfaces like clothing and paper and things like that, much less so. What we didn't recognize the last time I talked to you is probably how much transmission occurs from person to person through people who are asymptomatic. So most of what we've been doing in terms of screening is looking for people who have fever, looking for people who have symptoms, and those are the people we're trying to stay away from. Those are the people we're trying to quarantine. But it turns out that depending on the study, maybe a quarter, maybe a half of people can be asymptomatic and still transmit it. So that makes this a particularly difficult situation. So again, here's an example of droplet transmission. As you can see, what happens when we sneeze. So in a nutshell, the COVID-19 disease is something that we would expect would take about 5 days after a virus enters our body to start causing symptoms or start causing illness. That's an average. It can be as early as 2 or maybe as long as 11, but generally in that time frame we would expect people would start to show symptoms if they're going to. And in general, the younger you are, probably the fewer symptoms you'll have. And in general, the older you are, the more severely you're going to be affected by it. Again, this is just a rule of thumb. We think, and we don't know this yet because we don't have enough experience with the virus, that there is immunity that's conferred after an infection. How long that lasts, we don't know yet, but we're basing that on what happens with other coronaviruses that are similar in the same family and kind of what people's experience with those viruses has been. You've heard a lot about testing for coronavirus, and in general there are 2 kinds of tests. The one that we're doing here, and it's being done in testing centers and in hospitals all around the world, is the PCR test. That's the nasal swab, where they collect some material, some mucus from your nose, and they look for the virus RNA in that sample. And that tells us that that person has the virus. It tells us that they're infectious because there's the virus present in their body at that point. But one of the problems with this test is that it is subject to some false negatives, maybe as high as 30% depending on the study, and that has to do with the fact that sometimes whoever's doing the swab may not swab back as far as they should, or may have to do with where you are in the course of the disease when you get tested. So if you get tested really early, you may not have much virus, you may not be shedding much. If you get tested late in the course of the disease, maybe you're not shedding much virus at that point. So there are some limitations to the test. The test is helpful if it's positive. If it's negative, it doesn't absolutely rule it out. So that's the PCR test, and you can think of that as a test for whether you're shedding the virus. The second kind of test is a blood test, and that is a test that detects the presence of antibodies that our bodies make after we've been exposed to the virus. There's IgG and IgM antibodies. This is something that our bodies typically do when we're exposed to any kind of virus. These tests are just now coming onto line and really not available at this point in most places. And we'll probably use this as a measure of whether someone has been infected, and maybe ultimately even be able to use this test to see, who is immune or not at risk to get it again. That remains to be seen. So those are the 2 basic types of tests for this virus. So if we look at, this is kind of a busy slide, but it's kind of a scheme of what happens in our bodies when we, so if we get the virus here at day 0, we would expect that this is the line that detects what happens with the antigen or the virus particles. This is what the PCR test is measuring. So first 5 days, you may not have any symptoms, and you can see that the viruses would be maybe at their highest, maybe 10 to 14 days. So this is where, if you're going to have a positive test, we expect it probably would be up here. If you get tested down here, there's not as many viruses, and so you may not have a positive test at that point. But you can see what's happening in the blood. This is an antibody, IgM antibody, that's an IgG antibody. Those are the antibody tests that start to develop, and you can see that the IgG really isn't happening until about 2 weeks into it. The IgM is starting a little bit earlier. So that's kind of the whole time scheme in terms of when these tests are going to be helpful. As this virus level falls, this is when a person is actually starting to get better. And we expect to be not having symptoms, but this particular antibody will persist in their blood long after they're sick, and so it will be a measure of who has gotten the virus in the past. As I mentioned earlier, we have learned, since I talked to you last, that there's a lot more asymptomatic people that test positive for the virus than we realized. And the way that we have found this are in situations where we test everybody in a confined area. So you remember reading about the cruise ship, the Diamond Princess. They had an outbreak on the ship, and they went in and tested everybody. And 52% of the people who tested positive weren't having symptoms at the time. There was another study where they looked at pregnant women in New York City who were going in for their visits or their deliveries, and they were being tested before they went into labor. 88% of the people who tested positive weren't having symptoms. And you probably also heard about the Navy aircraft carrier, the Roosevelt, that had an outbreak. That was in the news a few weeks back. They tested all of the Navy folks on board, and of the people who tested positive, 60% were not having symptoms. Now, you have to remember that some of those people who are asymptomatic are going to eventually get symptoms. We would call those actually pre-symptomatic. In other words, you test at one point in time, it may be early in the disease, and you may not be getting symptoms yet, but you may still have the virus. But it's just, it makes it difficult because we're recognizing that people can test positive without symptoms. They can pass on the disease without symptoms. So when we do have symptoms of the virus, these are the typical ones that I'm sure you're familiar with. Fever, respiratory symptoms, cough, shortness of breath. A lot of people complain of chest pressure. GI symptoms tend to be a little more prominent than we thought. Diarrhea, stomach upset, flu-like muscle ache symptoms, and just overwhelming fatigue. Those are kind of the typical symptoms that were, when people have symptoms, this is what they often express. In our population of seniors, it's a little different, as it often is with a lot of other conditions. Seniors don't always have the same symptoms as the typical population. They tend to be more subtle, they tend to be a little different. There are cases where seniors may just be confused. I saw a resident from another facility last week at the hospital who just was sent in because he just wasn't acting like himself, he wasn't eating, and they noticed his oxygen level was a little bit low, and those were the only symptoms he was having. And unfortunately, he had the coronavirus. Often in seniors, fever may not be present either. And we may see more GI symptoms as opposed to respiratory. One thing about this condition, which is kind of unique, I think, is just the range in severity. We go from having no symptoms to very severe symptoms, to fatal symptoms. And this tends to relate to what's our underlying health. Do we have a lot of chronic health conditions? What's our age at the time? Remember that the majority of people, probably 80+%, will have very mild symptoms. Maybe another 10 to 15% will have symptoms that are enough to bring them to the attention of the medical care system, and maybe even need hospitalization for a short period of time, or some IV fluids, or just some support. And then there's maybe 5% who will need, extra ventilatory support and be in the ICU. And in terms of the fatality rate, it really depends on the population that we're looking at. I like to think of the severity of illness for this disease as an iceberg. The part that we see above the water are the parts that are symptomatic. Those are the people who have symptoms, those are the people who show up and go to the hospital. These are the people we don't really know about. And we won't find out about these people until we actually start doing antibody testing and realize that there's probably a lot more of it in the community than we realized, and that maybe it's been around longer. Recently looked at some data from the West Coast in California, where they're finding fairly high prevalence in the community, and they think that it probably has been circulating for longer than we realized. In terms of risk factors other than age, it really is just about any chronic health condition that you can think of. So if you have diseases of the heart or the lungs or the kidneys, underlying cancer, those are all things that increase your risk for a more severe disease. One thing that we're learning in this country is that obesity is a risk factor. That's something that the Chinese really didn't recognize because it's not as much of a problem in that society. Also, we're finding out that it's more of a problem for men than for women. So men tend to do worse with this condition. Not sure why that is. And again, as we talked the last time, it really matters what your age is. And again, age in some ways relates also to chronic conditions, and it's kind of a little hard to separate those. But I would say, if we look at those 80+, they may be up to 15 to 20% of those may not survive if they get infected. And if we look down here at 50 to 60, only maybe 1%. So it's a big difference depending on your age. If you remember anything from our talk last month, remember that we mentioned that the characteristics of this virus in terms of how it affects the elderly, and also how we care for our vulnerable in our society, we're coming together and creating what we call a perfect storm of a bad situation. And unfortunately, I think that's what we have seen in the last 4 to 5 weeks since we were together last. That we have a situation where we have elderly folks who have chronic health conditions living close together in facilities, and unfortunately these facilities don't have the same kind of resources that we would find at a hospital or our healthcare system. And so it has been a very unfortunate perfect storm, and I think we're going to hear more and more about that over the next few weeks and months. The skilled care facilities have become sort of the ground zero for this outbreak. That's where we're seeing the most severe cases and the most death. And this is something that we're seeing across the country in multiple locations. And initially, we were worried that the hospitals were going to be overwhelmed and they would not have enough ventilators. And in many communities, it's turning out that the skilled nursing facilities are where the healthcare system is being overwhelmed, more so than the hospitals. And that's the case in our current community as well. In the first nursing home where we had coronavirus infection in Washington State, the CDC went in and did a pretty careful study, and what they found at the end of that study was that 81 of 130 residents tested positive for the virus, 34 staff members, and 14 visitors till it was all said and done. They had the virus there and didn't recognize it until it was too late. At the time that the CDC went in and tested everybody, again, more than half of the people who tested positive had no symptoms. Now, a significant percent of those people went on to get symptoms, so we would say that some of those people were pre-symptomatic at the time that they did the testing. But unfortunately, as a result of that, 37 residents, mostly residents, a few staff, lost their lives. So this was the first case of coronavirus in a skilled nursing facility, and this happened in the adjacent county to where the first person in the country was diagnosed. And from this nursing home, it spread throughout the rest of the country. So in many ways, this is kind of where a lot of what we're seeing in our community today, in many ways it started. At least the thoughts are that maybe half of all the infections in our country can be traced back to this nursing home outbreak in Washington State. So what is our local situation like? I'm sure that you've seen lots of reporting about the sort of terrible situation that's happening in New York City and other large cities around the country. Italy, Spain. We've been spared that in Lancaster County. Our hospitals have not been overrun. But our nursing homes have been hit very hard in Lancaster. So far, and these are the statistics as of today from the Department of Health, or the State Department of Health, we've got over 1,300 positive tests, and we've had 86 deaths. Now, I know that the count is different depending on whether you go by the State Department or whether you go by our local coroner. The state numbers tend to be a little bit behind in terms of when they get reported. I think the coroner is now saying there's 107 or so. Again, just like the studies from China, if you look at the breakdown of ages, these are folks 90 and over, 80, 70, 60, 50. It looks like there really have been no deaths in people under 50 in Lancaster. If we look at what's happened in skilled nursing facilities in Lancaster, so far, according to the state, there are 22 facilities in Lancaster who have the coronavirus in them. And if you look at the fatalities from coronavirus in Lancaster, 2/3 of them are coming from skilled nursing facilities. And about 1/4 of the positive cases are coming from nursing facilities. And so far, 62 healthcare workers from facilities have tested positive in Lancaster, but no deaths that I'm aware of. So why is it that this virus is so difficult and hard on our seniors? We think it has to do with a difference in our immune systems as we age. Again, remember, this is a virus that none of us has ever seen before. It's unique, and so how we respond to it depends a lot on how quickly our immune systems can react. And it's not all about physiological age, it's also about chronological age, it's about physiological age. So, a person who's 80 and very healthy may do a lot better than a person who's 65 and has, 4 or 5 different health problems. So it's not just about age, it's really about underlying health. And also, seniors may have difficulty producing enough antibodies to protect them for the future. Just like we have to give special flu shots to people over 65 to try to boost their immune systems, seniors may not be able to make the level of antibodies needed to protect them in the future. So what are we doing to try to keep our residents here at St. Anne's safe? And this is something you're all very much a part of and very aware of. First, we're trying to just keep as few people coming and going here as possible. That's why I haven't been here for 5 weeks. It's why we're wearing masks all the time. If we can keep our masks on, even if we are shedding virus and not knowing it, it's less likely that someone that we come in contact with is going to get sick. We're being more cautious about carefully cleaning things, doing that more often. I'm sure everybody has heard many, many times about the importance of washing hands. Frequently, the virus that we pick up from touching a surface can be transmitted to our nose if we touch our nose or rub our eyes. And again, the importance of staying home if you are sick in any way. If you feel you just have something minor, like a cold or a GI bug, at this point in time, it's really important that you stay home, because you don't know if you could be one of those people who just has very minor symptoms. So if you have any symptoms and you have any question, play it safe, protect the residents, and stay home. And of course, we're screening everybody as they come to work for their temperature and their symptoms, travel history in the past, that sort of thing. I know this has been particularly difficult for our residents. It's very isolating. Particularly residents who are used to being up and about and on the go. Had a question from one of the residents who wanted to know whether it would be okay for them to get together with their other resident friend and go for a ride in the car if they both wore masks. And I think the answer is, unfortunately, that would be risky, and I would not recommend that. So at least until things calm down, until there's less risk in the community, I think it's important that we keep doing what we're doing. Because so far we've been spared here at St. Anne's, and we hope to keep it that way. So what are we doing here to keep the staff safe? So we do have protection equipment for staff, and we'll say a little bit more about that. Washing hands, making sure you're making use of the hand sanitizers on the wall, washing your hands with soap and water. Can't emphasize the importance of that enough. And also, it's important that we take time to remember that we take care of ourselves, that we maintain our health, these are stressful times, and So it's important to make sure that you're paying attention to your own health, that you're eating right, that you're getting exercise, you're getting sleep, and keeping healthy. In terms of protection equipment, PPE as it's called, the masks that we're all wearing, these are the surgical masks. The N95 masks we would use whenever we have residents who have the virus. Gowns to protect us from the virus being shed in droplets. Eye protection to prevent someone from coughing or sneezing and those virus particles from entering our eyes. So those are the kinds of equipment that we use to try to reduce our risk as we work with the residents. In terms of masks, there's a lot of information out there, a lot of stories about masks and not having enough masks and trying to conserve masks. And so if I would say a little bit about sort of the differences between them, what their uses are for, and what their, how we would expect to use them here at St. Anne's. The N95 masks are the ones that are made to exclude 95% of small particles, even down to virus-sized particles. They fit very tightly around our face, and so they actually need to be fitted. You need to try on and make sure that you have the right size, and you need to be tested to see that when you breathe, that air doesn't leak around it, and that you have a good fit. So that's something that we're working on now, is starting to do actually testing, so that when or if the time comes that we need to utilize these masks to take care of patients, that we know that we have the right size. The surgical masks that most of you are wearing right now, these are mostly to protect those around us from us. So when we breathe out or we cough or we sneeze, these masks protect the people around us from those viruses getting into the environment. They do also provide some protection to us from those viruses coming through. It's not as good as the N95 because these masks don't fit tightly around our faces and some air leaks around the sides. But there have been a number of studies that have shown that people that wear these masks in healthcare situations are protected from getting ill by wearing these masks. So the primary purpose of these is to protect the people around us, to protect our residents from us bringing the virus in, but they also do serve a purpose in protecting us, not to the same level as an N95, but certainly they do provide protection. The cloth masks that are homemade that you see, those also serve a protection of keeping the droplets from escaping. They're not very protective in terms of splashes. They get wet, so they're not what I would recommend that we wear while we're here. It's fine if you want to wear them out in the community, but I would say while you're here, it's better to have the surgical type mask. So I think in our community we have flattened the curve. We didn't see the big spike like we were concerned about. What we've seen is more the small gradual slope, but it's, I think, going to continue for a while. The measures seem to be working, as difficult as they are. But I think it's going to go on for months, and there's even concern about whether things will kind of ramp up again in the winter or fall. That remains to be seen. How severe this continues to be will be determined by, how good we are at practicing the things that we're told about hand washing and social distancing, but certainly we can't let up our guard at this point, because I think what we've done so far is working. The stakes are really high for our residents, and so it's really up to each of us, I think, to try to continue to work and keep doing the good job that we're doing. And I'd just like to say thank you so much to all of you here at St. Anne's, no matter what your role, because it's really because of you that we have done as well as we have. You've done a lot to help keep the residents at St. Anne's safe during this pandemic, and if it weren't for your dedication and your care and your love of the residents, we wouldn't be where we are today. So you truly are the healthcare heroes who are on the front lines. And remember that we are all working from home these days. And this is our residents' home, and that's where we're working. So, at that point, if you have any questions, I'd be happy to take them.
If we were to get a COVID-19 patient, positive, would they be shipped right to the hospital, transferred right to the hospital, or would we keep them here?
It would depend on their medical condition. So, let's say that they were medically stable, and a lot would depend on what their goals are. We'll start with that first. So if it's somebody that said, I really don't want to go to the hospital, keep me here, keep me comfortable if I get sicker, we would certainly honor that. If they said they were someone that wanted to progress to a higher level of care, that would be determined by their needs for the care, but not just necessarily by whether they're positive or not.
I have one, Dr. Spicher.
Yeah.
Can we be carriers and not ever get it?
Yes.
Does that make sense?
Well, in other words, we know that there are many people who get few of any symptoms. So yes, during that time that they have gotten the virus, they could have been spreading it maybe for a week or two and not been aware. So in that sense, they are carriers. It doesn't last for a long time. It's just a brief period of time during the window where they're shedding viruses, but may not have symptoms. And that's probably most likely to happen in children and young people. Yeah.
Do we know how long positive cases are shedding the virus for?
It depends on how sick they are. So if someone is otherwise healthy and has sort of a typical course, they may have fever, flu-like symptoms, and by the end of the second week after they first got it, they're probably not shedding viruses very much anymore. If there's someone who's been sick and in the hospital, and maybe doesn't have a real strong immune system, they may shed viruses for another week or two beyond that, so maybe up to 20 to 30 days from the time of onset of illness. So it depends on the individual. But in general, I would say 2 weeks.
So in the graph, where you had you said we flattened out our peak, which is good. Are we at the peak, or before it, or after it? Or
Well,
we just don't really know?
I would say we don't know for sure, but it's looking more and more like maybe the worst is over in terms of the numbers. A week ago, the hospital folks were estimating that we weren't going to see the peak till mid-May. And then the numbers started to drop off, and they continued to drop, and they've kind of remained sort of steady. You know, the number of people in the hospital with it, that number is staying, you know, kind of between 30 and 40, and it hasn't really been ramping up. And so it seems like it's kind of flat and maybe starting to decline a little bit.
Are they on to like a vaccine? Like how far into that are they?
You know, there's, and I don't know the specifics of this, I know there's a number of companies that are working on vaccines, but, you know, I haven't heard anyone really say realistically that it's going to happen sooner than a year.
That's what I was wondering, because you hear stuff and you read stuff, but you don't
I
really
don't
know.
think so. I mean, you know, getting a vaccine out and then testing it to make sure that it works and making sure that it's safe, those things take a long time.
Yeah,
There's only so much speeding up that you can do.
yeah. And people are saying this could be like a season, like a,
Yeah, I mean, it may be that a few years from now, we're telling everybody, you know, it's time to get your coronavirus shot, just like we say it's time to get your flu shot. It all depends. It depends on whether or not the immunity that we get after we're vaccinated or sick with it, depends on how long that lasts.
right.
Is there any idea how far out we are from the antibody testing availability and where they are with that?
I think it's only probably at most months, maybe even weeks. You know, some parts of the country are starting to do that. My son works in a hospital in Oregon, and they're offering that antibody test to the people who work in the hospital there now. So there's still a lot about that test that needs to be researched, but I think that it will be available soon. Keep up the good work.